afternoon, morning, 12 can go either way. My name's Molly Mitchell, and I'm the coordinator of the Mid-Atlantic Public Health Training Center, and I'd like to welcome you all to our July 2010 Public Health Practice Grand Rounds on Untapped Potential Innovations in Community Academic Partnerships to Prevent Injury. Before we begin today's presentation, for all those who are watching online, I encourage you to look at our other archives that are on our website, as well as our other trainings. And I'd like to draw your attention to some of our trainings that are coming up in the next couple months, including Outbreak Investigation Fundamentals, a team approach, Achieving Outcomes through Best Process Program Design and Evaluation, Grant Writing, Social Marketing and New Media, Creating Integrated Public Health Campaigns for the 21st Century. And for all of you watching online, if you have questions for the presenters at any time during this webcast, please just send in those questions by clicking on the link. And we also ask, if you are online, to please sign in so we can have an accurate count for our federal funders. And with that, I'll go ahead and introduce today's presenters. Eileen McDonald is an associate scientist at the Johns Hopkins Bloomberg School of Public Health in the Department of Health, Behavior, and Society. She is also a member of the core faculty of the Center for Injury Research and Policy in the Department of Health Policy and Management, where she has a joint appointment. Ms. McDonald was a co-creator of the Johns Hopkins Children's Safety Center, and as director, Ms. McDonald now oversees 3 Johns Hopkins Safety Centers. Ms. McDonald has authored a nationally distributed guidebook for child safety, a curriculum for alcohol and drug training for pediatricians, and numerous research articles on injury prevention and health education topics. Ms. McDonald received the Early Career Award and the Mohan Singh Award from the American Public Health Association, as well as awards for teaching and mentoring. Ms. McDonald holds a bachelor's degree in health education and a master's degree in health administration. Our other speaker today is Shannon Frattaroli. Shannon Frattaroli, PhD, MPH, is an assistant professor in the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, where she is affiliated with the Center for Injury Research and Policy and the Center for Gun Policy and Research. Her research interests include understanding the role of policy in improving the health of populations with particular attention to injury prevention policies, the implementation of public health policies, and the role of advocacy and communities in the policy process. And finally, last but not least, we have Deputy Chief Raymond O'Bricky. Deputy Chief Raymond O'Bricky has served in the Baltimore City Fire Department for over 20 years. He was appointed Fire Marshal for Baltimore in 2008 by Mayor Sheila Dixon and retained by Mayor Stephanie Rawlings Blake. During his tenure as Fire Marshal, his office has reduced fires in city public schools by 61% and reduced the city's fire death rate by 30%. He has sat on the state's Child Care Advisory Council and the Maryland State Fire Code Update Committee. Chief O'Bricky resides in the Federal Hill section of Baltimore City with his wife and 2 sons, and is currently a law student at the University of Baltimore School of Law. So with that, I'm going to hand the floor over to Eileen McDonald.
Thank you, Molly. Good afternoon, everyone. We'd like to start by thanking the Center and DHMH for allowing us to speak today in the Public Health Practice Grand Rounds. We're excited to share some of the work that we've been doing. And by way of commercial, I couldn't get out of this opportunity without taking the time to give a little commercial for the Johns Hopkins Center for Injury Research and Policy. Most of the work that will be presented today has actually come out of the the Injury Center, and CIRP, the Center for Injury Research and Policy at Johns Hopkins, is one of 11 federally funded centers of excellence around injury control. Our founding director, Professor Sue Baker, who's in the audience with us today, is widely recognized as one of the leaders and, in fact, helped develop and create the field of injury control. So it's a real honor to have her and to work with her. The mission of the Hopkins Injury Center is to close the gap between research and practice by conducting high-quality research that's vital to the development, implementation, evaluation, and sustainability of policies and programs designed to address this public health burden. It's also a goal of the Injury Center to bring this research to bear on current practice and help to close the gap between research and practice by reaching out to public health practitioners and helping to train the future leaders in the field. The center's research portfolio is quite extensive. It covers all the phases of the injury problem, from prevention, acute care, and rehabilitation. It addresses the two different types of injury causes, both intentional and unintentional. The research phases that our work centers around include foundational research, intervention research, and translation research. The Injury Center, from its beginning, has had a real focus on vulnerable populations, meaning folks with low income, young children and older adults who are more vulnerable to injuries, even trauma survivors. The Injury Center has also had a focus on consumer products and the role that they play in contributing to, and by that I mean causing injuries, but also contributing to by preventing injuries. So there's been a real focus on motor vehicles and the combination of motor vehicles and alcohol, boating, airline safety, a lot of child safety issues. And then finally, the Injury Center has been exploring the use of innovative information technologies to bring information and programs to communities of interest. I also wanted to take this time, particularly for those folks in the audience, to let you know about the probably 20 or so injury courses that are available here at the School of Public Health in a variety of departments. And there is an opportunity to gain a certificate in injury control by taking a minimum of 7 courses from a pre-approved list. And you can find more details about the injury certificate and the injury courses on the Injury Center's website that you see noted at the bottom of the slide. For those of you not on campus and who may be done with your formal academic training but may be interested in pursuing additional educational opportunities around injury control, there are a couple of upcoming opportunities that I also wanted to let you know about. One is an annual event that happens in the summer called the Summer Institute on Injury Control. And typically this is held in July. It's a 4-week kind of 4-day intense course of injury control information. And this coming July, that will also be paired with a more advanced opportunity, a 1 to 2 day advanced institute to explore more complex topics of injury. In 2012, the Injury Center will be celebrating its 25th anniversary, and there will be a variety of events going on throughout the year. So please check back to our website for more details about that. And then finally, in 2013, there's a relatively new injury group called SABRE, which stands for the Society for the Advancement of Violence and Injury Research. And many of the Injury Center faculty, including Dr. Frattaroli and Dr. Gielen, are leaders in SABRE. SABRE will be hosting its annual conference here in Baltimore in 2013, and the Injury Center will be co-hosting that. So there will be some special opportunities in our own backyard to address injury and violence topics. Specifically, what we wanted to do today in our time with you is to provide a brief overview of the public health burden caused by fire and fire-related injuries. I'll be sharing with you results from a national survey of prevention activities in U.S. fire departments. Dr. Frattaroli will be exploring a few case examples of SERP and fire service partnered research activities, both at the state and local level. We'll also outline kind of the challenges and benefits of these community academic partnerships, and then really try to challenge you to think about opportunities to partner with the fire service, because there's great capacity there. There's much that the fire service has to teach public health and vice versa. So I think it really is a great and potentially powerful partnership. So let me just start with a very quick review of the fire picture in the United States. This is a table that shows for the last 10 years, from 1999 to 2008, the numbers of fires, deaths, and injuries, and then the total dollar loss of those activities. The good news is that the trend is going downward. The number of fires are being reduced, and consequently, the numbers of deaths and injuries. But the takeaway picture here is that, the takeaway message is that still more than 1 million fire incidents are happening, more than 3,000 people are dying annually, and more than 16,000 people are being injured by fires every year. And many of these fire incidents and fire deaths and injuries could be prevented. In a very recent publication by one of our Injury Center colleagues, Dr. David Bashai, in the May-June public health reports, he recently examined trends in fire injuries and deaths or kind of across the lifespan, and looked at particular disparities. And his work showed that compared to non-Hispanic white people, that Native Americans and African Americans aged 55 and older are at an increased risk for fire deaths and injuries. So there is still quite a bit of work to be done. So that's a very quick picture, kind of what's happening on the national level. In our own backyard in Baltimore, using data made available from the Baltimore City Fire Department for the calendar year 2008, we learned that 58 civilians were injured in fires and 19 individuals died in fires in 2008, with a total loss of more than $21 million. And then in a 2009 report published by the Baltimore City Health Department, they compared the risk of Baltimore children dying in fires compared to the U.S. Average, and found that Baltimore children are more than 2 times likely to die of a residential injury compared to children in the United States in general. So again, big problem, and what do we do? Is it likely that fire departments can increase their response time to get to injuries more quickly, or can they improve their fire suppression efforts? There may be, small increases that can happen there, but I think if we're really looking to make significant changes in the fire burden, we need to look to prevention. And that's what the remainder of my talk is going to focus on. So my colleague, Dr. Andrea Gielen, who is the current director of the Center for Injury Research and Policy, and I, as well as some other colleagues at Hopkins, had the opportunity, through support made available from the Home Safety Council, to work with a variety of fire service-related agencies to conduct the first ever survey of fire departments across the United States to get a sense of what they were doing in terms of their fire and life safety prevention activities. Specifically, the purposes of the survey were to benchmark fire and life safety activities in U.S. fire departments, and to identify needs for training, resources, and other supports to enhance these activities. We had access to a 2006 directory that lists all fire departments across the United States, and learned that there are more than 2,100 fire departments across the United States. From that total population, we created a stratified random sample of 7,408 fire departments, and we stratified on 3 different areas. One, in terms of population size, we looked at those fire departments serving a community defined as less than 10,000 versus more than 10,000. In the fire world, the country is divided up into 5 regions: Northeast, Midwest, Southeast, South, and West, and those became the 5 regions that we stratified by. And then we also stratified by the 3 different department types that make up the fire service in the United States. There are fire departments that are run fully by volunteers, others that are run completely by career individuals like Chief O'Brockie, and other departments that are a combination of those 2. So we felt it important to fully represent the fire service by stratifying on all of those different types. With our fire service partners, we created a 35-item survey and mailed that out to our sample. And non-respondents were followed up with a mailed postcard and then a telephone call if they still did not respond to that. And then through our sample size, we were able to calculate national estimates and compare fire departments by these 3 different ways that we stratified them, so size, region, and type. The data that I'm going to share with you today are just the national estimates, but if anyone is interested in the full report, it is available either from the Johns Hopkins Center for Injury Research and Policy website or the Home Safety Council website, and it has a report for each of the 3 different ways that we stratified our data. So generally who our respondents were, we had a total of 1,523 respondents. Mostly they were fire chiefs who had been the fire chief for about 8 years, but had been in the fire service for 25 years. So these were folks that were not wet behind the ear. They knew the fire service inside and out. And the table that I just am sharing with you now shows the results broken out by our stratified levels. But again, the data that I'm sharing with you are for the entire national estimates. So the results will focus on answers to 4 main questions. Who's doing fire and life safety? What types of fire and life safety activities are they involved in? Who are they partnering with? And what are the barriers and facilitators that fire departments report in terms of doing either more or better or more effective fire and life safety activities? So from our results, we estimate that nationally 86% of fire departments report conducting some type of fire and life safety activity. We were wanting to know who in the fire service was doing this, and so we asked a variety of questions, but one of the most informative ones is that more than half, 56% of departments are using uniformed personnel who are not exclusive to fire and life safety. So meaning they have multiple responsibilities. They are not dedicated educators, but instead they may be firefighters who have suppression responsibilities, inspection and code enforcement responsibilities, a wide variety of other responsibilities aside from education to do the fire and life safety education activities in the fire department. The survey also listed a variety of fire and life safety activities that fire departments could potentially be involved in, including things like you see here, elementary school presentations, fire and safety month events, even including things like worksite activities that aren't listed on the table. But these are the responses of the most frequently reported activities that fire departments were involved in. So you see that the great majority of activities happening in the fire department are directed at children through elementary school presentations, reported by about 80% of the respondents. Almost 70% of departments report being involved in fire safety week or month events or conducting activities with older adults or participating in health fairs. Fewer fire departments report being involved in activities specifically targeted to youth who may be identified as potentially going down the wrong road in terms of a relationship with fire by participating in juvenile fire setting prevention programs, conducting community-wide canvassing or sweep activities where the department goes door to door in selected neighborhoods to promote smoke alarms. Even fewer fire departments report being involved in child passenger safety or more nationally validated curricula like the Learn Not to Burn and Risk Watch programs that are available. We were also curious to know if, in addition to education, fire departments reported either distributing or installing a variety of fire and safety related products. And so, as you might guess, this isn't anything earth-shattering, I'm sure, that about half of the fire departments report either distributing and or installing conventional smoke alarms. And by conventional smoke alarms, I mean those that are powered by a 9-volt battery that needs to be replaced, at least once a year. Fewer departments are involved in the distribution or installation of more specialty type alarms like lithium battery smoke alarms that are considered the gold standard, that have a battery that powers them for 10 years, thus reducing kind of the burden for the individual homeowner, or for smoke alarms for the deaf or hard of hearing community. Very few fire departments involved in that unique population's needs. We were also curious to know if fire departments are involved in advocacy either at the local, state, or national level, and about 39% of our respondents reported doing so. And we also asked if they did, what were they advocating for? And again, smoke alarms were at the top of their list, with about 85% of our respondents participating in advocacy activities at the, again, local, state, or national level. And you see the list and the frequencies related to fire and building code advocacy, fireworks, carbon monoxide detectors, etc. Evaluation is critical. For those of you in public health, you all know this, but it's an area that frequently gets overlooked. So we were curious to know how evaluation is handled in the fire department. And 52% of departments report doing some type of activity to evaluate their fire and life safety activities. However, when we delved a little bit more closely to get a sense of what kinds of strategies they're using for evaluation, the most popular response was getting informal feedback from participants. So not very powerful information. It's a good start, but there are opportunities for improvement. As you can see, only about 20% of departments report being involved in injury loss statistics or in conducting observations. By that, it might be an example of actually going into the home and testing the smoke alarm to determine if it's working or not. Even participating in public opinion surveys and pre and post tests were very infrequently reported by fire departments as an evaluation mechanism. Kind of on topic of what we're here to talk with you about today, we were very interested in learning about partnerships with who fire departments are partnering to conduct, to support, deliver, or promote their fire and life safety activities. And about 37% of our respondents did say that they partnered with some agency or group to conduct these activities. Again, when we asked a little bit more detail about that, we learned that they're most likely partnering with the recipients of the training. So 88% of fire departments reported partnering with schools and classroom teachers to conduct the fire and life safety activity. So it's a very natural relationship, but it's not really pushing the fire department to think about the benefits for partnering with other types of groups. 37% of departments reported having a special relationship with senior centers and with businesses and employers in their area. But I think a real missed opportunity is public health department partnership and safety coalitions, where you might expect to find public health folks in being involved in safety coalitions. There's great opportunity to build and improve partnering opportunities between those organizations and the fire department. Again, we realize that the fire department is not exclusively an education agency. They have lots of mandates and responsibilities, so we were curious from their perspective what the barriers and facilitators to doing fire and life safety activities were. And what fire departments reported back, the most popular things that would help them do a better job of these fire and life safety activities, if they had better access to safety products to distribute, if they had better access to community materials that they could, again, distribute and use in their programs, and if they had information about funding opportunities for fire and life safety activities. And then barriers, again, nothing really earth-shattering here. It seems like any survey that explores barriers, the same kinds of issues come up: time, money, and priority. So there's not enough funding to do it. There are too many competing priorities in the department, and there's a lack of time to do fire and life safety, were the most common responses to our barriers. But some of that could be, the perceptions of the importance of fire and life safety. It could be the capacity and obviously the resources that the fire department has to do these kinds of activities. So in just wrapping up my setting the stage with providing this national picture of fire and life safety activities at the national level, the conclusions that we drew from our survey was that the majority of departments report doing some type of fire and safety education activities, and that most providers have multiple responsibilities, that presentations and community events, usually primarily targeted at children, were the most frequent types of activities reported, and that distribution and installation of products and advocacy were less frequently reported by departments. And clearly, we walked away from this with an understanding that there's an opportunity to strengthen partnerships with public health departments, even schools of public health, and a lot of what Shannon is going to be talking about, I think, really builds on this last point and shows the great potential for partnerships between academic and community centers. So let me turn it over to my colleague, Dr. Frattaroli.
Thanks, Eileen, and welcome everybody. Thanks for taking time out of your day to spend a little bit of time with us talking about what we here on stage view as a critically important problem for public health. And we hope that you walk away from here with some new ideas as to how to address this and energized with some good ideas as to how to reach out to potential partners to address this issue. So Eileen, I think, did a great job of setting the stage in terms of providing a general picture about what the fire service in the United States is doing with regard to prevention and fire and life safety. So hopefully what you took away from that is that we have this great network of people who are thinking about prevention, who are tuned into injuries, and who are at varying levels quite engaged in the types of issues that we in public health are also very committed to addressing. What I'd like to do with the time that I have is to share with you some examples of some partnered relationships that we've enjoyed over the years with the fire service in order to provide you with sort of a more detailed account of what exactly a partnership with the fire service can look like, what kind of information you can get out of it, and the real rewards that can come from doing this type of work. So we're going to move from the general in Eileen's section to the specific in mine, and I hope that this combination of perspectives is helpful in giving you an idea as to how you might work in the future with these kinds of agencies. So the first project that I'd like to tell you about is some work that we did in Delaware. A few years back, the United States Fire Administration, which is the lead federal agency that supports the fire service, came to us with an interest in learning more about what the fire service is doing in regards to prevention. So the USFA traditionally has really focused on supporting the fire service through their suppression activities. Very important, and certainly no one would argue that we want the government to be supportive of the men and women on the front lines who do suppression work. When your home's on fire, you want someone to come quickly and be well equipped. But in recent years, the USFA has sought to really expand its focus to include more prevention activities. And in order to do that effectively, they reasoned that it would be important to understand what's going on. And for those places where a lot of good prevention work is happening, they wanted to understand what that work looked like and what were sort of the motivators that were allowing that to happen. So we agreed to work with them in order to accomplish this task, and we identified through conversations with our federal leaders that Delaware was was one of several states where people looked to as really doing a lot in regard to prevention and a place where we thought a lot could be learned. And I'll just comment that I don't think it was insignificant that at the time they had a huge champion in the federal government for the fire service. Of course, their then U.S. Senator, the man who is now our Vice President, Vice President Joe Biden, has historically been a huge supporter of the fire service, and at the national level, he has long advocated for support for the fire service nationally, but also in his own state. So certainly having Delaware be at the forefront of a federal agency's, radar screen, I think was probably related to the fact that they had good leadership in the state who were constantly advocating for them. So we went to Delaware, and we really sought to accomplish three things with our study. We wanted to learn what they were doing with regard to fire prevention programs and policies. We wanted to get a sense for what the impact of some select initiatives might be having on the population, and specifically with regard to impacts on fire deaths and injuries. And we really were attuned to learning from them what kind of lessons or experiences could be gained from the Delaware model to apply to other states that maybe weren't as far along with regard to their prevention activities. So in order to do this, we thought that the best approach would be to approach this work from using the case study method. So we put together a study that drew from a number of different approaches. We conducted a series of interviews with leaders in the fire service throughout the state. We were in the field and attended a number of prevention events, so we observed the activities that they were doing in terms of advocating for policy, distributing smoke alarms, and we also collected and analyzed a number of documents that really helped us to understand what they were doing in Delaware with regard to their fire prevention activities. And in keeping with the theme of this talk, I will just say that partnership and having going into this work hand in hand with the leaders in the Delaware Fire Service was absolutely essential to getting access to the people that ultimately informed our work and getting the information that we needed in order to inform this. And much of what we were doing was informed by many conversations that we had with the fire service in that state in order to identify priorities for them as well as to meet the goals and the needs of the federal agency. So this was an example where partnership was not just beneficial and enjoyable, because people in the fire service are generally wonderful people, but it was also really essential to us being able to do the work that we were being asked to do. So what we learned after spending a good deal of time in Delaware was that it came down to really these kind of numbers. We identified 7 different programs that they had running at the state level in Delaware that were focused on fire prevention. We also identified 10 different types of programs, in addition to those 7 state-level programs, that were being implemented and carried on at the local level. So a small state like Delaware, about 700,000 people live in the state, they had a lot of resources really devoted toward fire prevention. So the USFA was right on target when they guided us toward Delaware in terms of being able to find a richness and variety of prevention offerings there. Just to give you an idea of some of what's going on in the state, I've highlighted here some select programs that we learned about. And there's some, really interesting things going on up there. At the state level, Eileen made reference to the fact that in the survey that we conducted, there were a number of states that reported, although a minority, that reported having juvenile fire setter programs. This is a fascinating program, and it might be something that we in public health don't often think of the fire service as doing. Juvenile fire setters involve an intense intervention with young people who are found to be engaging in arson activities. And so this, to me, when I was learning about this juvenile fire setters program that they have in Delaware and that they have in many other states throughout the country, it really called to mind many of the sort of clinical interventions and the mental health interventions that we in public health often look to, that is very much a part of our field. So I see that as sort of one entree to potential partnerships, is to work with them around these juvenile fire setters interventions. We also learned about a program at the local level in southern Delaware that was distributing smoke alarms at a chicken farm. So one of the local firehouses down in southern Maryland had sort of looked at their prevention work, looked at who they were able to reach out to, and they saw that they felt that they were getting access to and reaching a lot of people in their community, but the people who they were concerned that they weren't reaching were the workers who were coming up from Central America, who weren't at their events, who weren't coming into the firehouse, and they were concerned that because of language issues and other cultural issues that they might not be getting their messages and their prevention work to them. So they reached out to one of the local employers who runs one of these chicken farms in southern Delaware, and worked with them to set up a program whereby they, on payday, when workers come to collect their checks, right next to the place where they collect their check, there's also someone from the fire department who's distributing smoke alarms and distributing information in Spanish so that they can get the information and the products they need in order to make their home safe. So that was an example of a really innovative program that we were excited to learn about, and that just really was characteristic of a number of the things that we learned about when we were spending time in Delaware learning about their prevention activities. So the other example that I wanted to talk about, and there are 4 programs that I'd like to talk about briefly, is while we're all very passionate about injury here, we realize that public health is more broad than just injury prevention. So I wanted to take this opportunity to highlight for those in the audience a partnership that is focused on a different outcome, a different public health outcome than injury. And we're currently engaged in a project that's being led by Dr. Keisha Pollack, who's in the audience here today. We're currently in the field with a project that is looking to understand health and wellness among the fire service. So this is a partnership that involves looking not at the community as a potential target for our work, but as the fire service themselves. So this has more of an occupational health focus. And this project involves a partnership with a national organization called the National Volunteer Fire Council, and they've been, great in terms of getting us access and providing us with information that we need in order to go into the field in an informed way. So that's another type of partnership that I think it's important to understand when we do this type of work, is that we've got our frontline people who are great to reach out to, but there's also these umbrella organizations that seek to organize and support our frontline workers that also make for great partners in our work. So just to give you a general overview, with this study that we currently have in the field, we're really looking to understand what firefighters think of when they hear the words health and wellness. We're looking to identify specific barriers and facilitators to actually implementing effective interventions that can help improve health and wellness among firefighters. And then in the third phase, or third aim of this project, is to actually take that information that we gained from the field and turn that into a pilot intervention that we will then evaluate to see if it's effective. So this is a project that we're all on the team very excited about. And I think, again, it really speaks to the way that practice and research can come together to build the best interventions and to inform our work in the best possible way. We knew that we hadn't spent a whole lot of time in firehouses. We don't know what it's like on the research team to be a firefighter, the challenges they face with regard to their schedules and the demands on their time. So we thought it was incredibly important to hear from them prior to building an intervention for them. And I know I can speak confidently on behalf of the team that process has been invaluable in terms of our understanding and ability to go into the field with something that we can be optimistic will have an impact. So we have 4 phases to this study. The first phase is underway. It actually involves engaging role models in the volunteer fire service who are interested in improving their health and wellness, and working with one of our team members, Dr. Larry Cheskin, in a clinical setting to think about ways to improve their diet and exercise routines. So we've got these role models who have been working with Dr. Cheskin over the course of the project and have realized some good success and are sort of chomping at the bit to get out there and share their success and hopefully motivate their fellow volunteer firefighters to adopt similar changes. As I mentioned, we have this process where we're going out to the field and talking with volunteer firefighters in their firehouses to understand how they view health and wellness and what we can do to better serve them with our interventions to address those needs. So we've conducted a series of focus groups throughout the state of Maryland, and I'm including this map here to show you the many places that we've visited. We really made an effort to get out to rural areas, to get to all the regions of the state, and to get as broad of a representation and input with this project as we can. And Dr. Pollack was very creative and put together an estimate of the number of miles we drove, and I want to say it was about 1,400 miles that we logged in on this project. It was lots of fun, but importantly, it was just incredibly insightful to hear firsthand from people on the front lines of our fire service in this state how we can better serve them with regard to our public health interventions. We're now in the phase where we're taking these focus group results and developing an intervention and talking with the different fire departments that we worked with to sort of feed back our results from the firehouse, from the focus groups, and get additional information as to how best to move forward with phase 4, which will again involve piloting and evaluating an intervention that's developed out of this. So the third example that I want to highlight here is one that I'm just very excited about these days: residential sprinkler policies. I don't know how many of you have heard about the really raging policy debate that's currently going on in this country with regard to whether or not residential sprinklers should be mandated in single-family homes. And this is an area that I and the people at the center who work on this issue really believe is ripe for partnership with the fire service. And there's a real need, from my perspective, for more public health input on this issue. So for those of you who may not be familiar with the process of building codes and developing building codes that govern how homes and buildings are built in this country, there's one group called the International Code Council, which develops model codes that sort of specify how residential and commercial buildings go up. So these model codes are voluntarily adopted by states and localities in this country, and by and large, these codes are, sort of what states and localities look to when they're building their codes around building safety. There was a huge victory in October of last year with regard to the International Residential Code, and it actually happened here in Baltimore when, after lots of very passionate debate over the course of decades, the International Code Council voted to adopt an amendment, or voted to adopt into their codes a requirement so that new 1- and 2-family homes are now required in the model code to have sprinkler systems. So that was a very exciting development. Again, it was the result of many decades of hard work and advocacy by our fire service and fire prevention partners, but it's done. So now this code that exists does state that for new construction, single-family homes need to be sprinkler equipped. And so this was a very exciting development, and according to the code, it's set to go into place on January 1, 2011. And for those of you who don't know about sprinklers, I mean, this is one of those issues that just, for me, it's such an obvious solution. We have, thousands of people dying every year in this country as a result of fire deaths. The overwhelming majority of those deaths occur in the homes. The sort of go-to intervention for fire prevention as it currently stands are smoke alarms, which are an important tool is in our arsenal to prevent fire injuries. However, the best that smoke alarms can do is to alert the occupants to the presence of a fire, alert them in the hopes that they can wake up or be alerted in time to escape from the building. And it's been an important tool. We know that it's an effective measure, but we have an even more effective tool in our arsenal, and that is in terms of sprinklers. Sprinklers have been around for over 100 years. They're a proven, effective intervention for not just alerting people that a fire is in a building, but actually extinguishing or controlling a fire. When we go to work in this building, we're protected by fires. When you stay in a hotel, you're protected by fires. But the single-family home, is sort of the last place in this country where we haven't taken that extra step to use the technology that we have available to the best possible resource and require that they be installed in homes. So this development is a really exciting one, and it's one, again, that many people in the fire service have worked for decades in order to make happen. And I'd like to see public health take a more active role in assuring that these codes are adopted by states and localities, and that once they are adopted, that we understand and can help assure that they are implemented and evaluated. So, as I said, the first bit of good news was that the ICC passed this resolution, and that's now on the books as part of the International Residential Code, that new single-family homes need to include sprinklers. But what we had in the short time since that vote was taken was a flurry of activity, and it was sort of a flurry activity in sort of a good way, and also in a challenging way. When I last checked, we have about 5 states that have actually moved forward and actually taken the steps to actively adopt the International Residential Code. So those 5 states are really set to go and require residential sprinklers in new home construction in the very near future. As in terms of a challenge, we've also seen a tremendous effort on the part of opponents to sprinkler policies who have organized and, in fact, over a very short period of time have introduced legislation in at least 25 states to undermine what the International Code Council has done. And what they've done is to propose and in some cases pass bills that would preempt localities from passing ordinances that require residential sprinklers. We've seen bills that would prohibit states from adopting the sprinkler section of the revised IRC code, and in some cases those have passed. And we've also seen, a bit of back and forth. So in Pennsylvania, which I believe was the first state to pass through legislation the adoption of the new code, the home builders were quick to file a lawsuit against the state, attempting to prohibit them from adopting the 2009 International Residential Code. So there's a lot going on. As I said, it's just a really fascinating policy debate that could use additional voices to help bring us to a point where homes are maximally protected by this really wonderful technology. This is also a fight that's been going on. It's been very active on the local level. So nationally, when we look at sort of localities and what they've done with regard to sprinklers, an estimated, over 300, between 300 and 400 localities have actually adopted policies on their own to say, we in our community want residential sprinklers to be required of all new home construction. Within Maryland, we've been doing a great job on this issue. Last count was that about 27 localities have adopted fire sprinkler ordinances. Chief O'Brockie was part of the force that led Baltimore City just within the last month. Was it this month? In June, okay, to pass a resolution that adopted a residential sprinkler requirement for the city. So we are now, I'm proud to say, the largest locality in the nation with a residential sprinkler requirement. And we're seeing things going on in other counties like Howard County as well. So one of the challenges is, and looking forward as to how we can continue to advance this policy, the majority of these laws really speak to new home construction, but certainly the technology is available to retrofit homes. So that's something that you see some movement on, although it's controversial. And then there's also this, group of policies that are coming up that are saying, well, we're not going to adopt the residential code and say that you must include sprinklers in your new home construction. What we're going to say is that we're going to mandate that you offer this as an option to buyers. So this mandatory option provision is something that's coming up that's a bit worrisome that we need to keep an eye on. But it's just an example of really the richness of opportunity that exists on this issue, and really, again, the need for more voices and more advocacy from injury prevention and public health people to assure that in the end we come on the right side of this issue. And I'll just close on this third example with what I think is a very powerful demonstration of why we really need to support advocacy efforts that are attempting to get fire sprinkler technology into homes across this country. What you see here is a side-by-side burn. It's a demonstration that was done up in Rhode Island about a year ago. And the home on your left, or the sort of mock-up on your left, is a home that was equipped with sprinklers. The home on your right is a home that was not sprinkler equipped, that relied on, it was equipped with a smoke alarm. And these pictures were both taken at 10 minutes after the smoke alarm went off, which is sort of an estimated time in when you can expect the fire crews to respond. And so after 10 minutes of starting a fire, we have a home that is sprinkler equipped that you can imagine walking out of, and a home that is not sprinkler equipped, where the fire crews are arriving and they're going to do their best to get people out, but that's a pretty bleak situation. So we have the technology to address this very serious problem. And again, we would just like to encourage you to engage in this issue. There's a lot of good work to be done. And I want to end with our fourth example and sort of segue into Chief Obrake's section of this talk to talk about a little bit about the really wonderful partnership that we've developed over decades now with the Baltimore City Fire Department. And the latest incarnation of this partnership is the Mobile Safety Center, which you see pictured here. And the Mobile Safety Center is a large tractor trailer that includes exhibits that talk about injury prevention, that talk about fire prevention. It's jointly staffed by people from the injury center and the fire department. And it's really a wonderful way to bring injury prevention education and products that we know are effective in preventing injury to the community. And I'll just say that this is one of many outgrowths of our partnership, and we at CERP look forward to many more productive and wonderful years of partnering with the City Fire Department to really address the very serious problem of fires that exists for our people in this city. So with that, we'll hear from Chief Obrake.
Good afternoon. Just to let you know the difference between a fire marshal and a fire chief. I'm deputy fire chief, but my title is fire marshal from the city. I'm responsible for all the code enforcement, the fire code enforcement that goes on, all the fire arson investigations, all the public education campaigns, and we are the record keepers of the fire service, fire department. One of my related duties as fire marshal is I have to respond to every fatal fire in the city and oversee the investigation. When I first became fire marshal, I took a very passive role in that. I would confer with the investigating captain and facilitate any needs that he required. We had a fire about 18 months ago. It was in East Baltimore, and two young people, two Chinese nationals, died in a second-floor apartment that was over top of a store which they worked. It was after that fire I decided to take a new approach, because the things that I saw in that fire. The two victims, 23 and 24, born in China, moved here, worked the store, were not careless folks. We saw no evidence of candle use. They weren't smokers. They had state-of-the-art burglar alarm system, locks, they barred windows. They were very conscious of their safety, but they didn't have one single smoke alarm, not one. The fire started in an air conditioning unit that was mounted high on the wall by the ceiling. It burned into the wall and then spread to the second floor middle room. It was a slow, smoldering fire, the investigation revealed, because of the heavy charring in the wall unit. That meant it moved slowly before it really built, and then when it broke out of the wall, it moved very quickly. And the location of the fire was pretty unfortunate. They slept in the front room. This was about 2 in the morning. And the fire broke out in the middle room, which separated them from their means of egress, the stairwell to the first floor and out of the dwelling. The victims must have been terrified. They didn't die in their sleep. The male tried to make it for the window, but it was barred. We found his body beneath the window with his hand still clutching the barred window. The female tried to make it through the fire room to the steps. We found her less than 36 inches from the top of the step. I often wonder if she ever knew how close she came from making it. Well, once the fire was extinguished, the investigation was being conducted. We had taken our pictures. We were waiting for the ME to come pick up the bodies, and I decided to take a more active role with the firefighters on the scene. So I gathered the first arriving engine. They're the guys that have the water and the hose, and the first arriving truck company. And I said, did you guys have any problems getting here tonight? I said, were you in quarters? Were you in another part of the district? And they said, no, we were in quarters. We got right up, got right out. I said, how long did it take you to get here? He said, about 3 minutes. And I said, did you have any problems getting water? Was it the hydrant dead? No, it was a hydrant right on the corner, perfect. I said, how long did it take you to get a line in service? Did you have problems getting access into the place? or laddering the building? They said, no, we got the fire knocked 5 minutes after we were here, had the fire out. And I said to the truck officer, I said, did you have any problems gaining access with the barred windows? They said, no, we threw a ladder, we got our carbon tip laid out and saw right through the bars, found the victims in 5 minutes. And I said, so everything went smoothly? And the officer said, yeah, textbook. And I said, everything went smoothly, textbook as you put it, but 2 people died anyway. And one of the younger guys on the crew said, yeah, there was really nothing we could do about it. And I said, that's where you're wrong. I said, if you had knocked on this door yesterday, last week, last month, installed a smoke alarm for these folks, they would have been standing outside when you pulled up, pointing up at their second floor apartment on fire. So I tell that story, not that it has anything to do with partnerships per se, to illustrate a couple points. One, that these statistics have real people behind them. 2, it is a very big problem in Baltimore City and the nation at large that nobody seems to recognize. And 3, line firefighters who do the majority of the fire prevention, as Eileen's survey pointed out, really aren't prevention oriented. They're not prevention minded. I'm sort of like the conscience of the fire department when it comes to prevention, that I keep trying to remind and educate my own that this is important, that it's part of their duties, and that in a real way, I'm a culture within a culture. Later on, I'm going to talk about the clash of cultures and the partnership between Hopkins and the BCFD that we had to overcome. But there's still this ongoing fire department culture, this cowboy culture of let's get on the ding-ding and ride fast, and, well, smoke alarm's something they make us do. So I'm not going to read all the slides, but I'm going to read this one. Any person who is all conversant with fire safety knows that at least 85% of fires could be prevented. It is the duty of the fire chief to assume leadership and point out the way for the protection of life and the conservation of property of our citizens. The modern fire chief knows that he must be up and doing and prevent fires from starting if he is to be successful in reducing the fire loss. That was said in 1928. The modern chief was Chief Brosnan. Okay. We had heard some of the numbers of the national fire problem. It is a problem that nobody seems to think is a problem unless you have a fire. Fire deaths kill more people, more Americans every year than all natural disasters combined. But you rarely see any big fires on the news because it's a one-person event, 2-person event, 3-person event, here, there, usually affects poor communities. Now, these are the landmark documents that have been generated at the federal level. The very first one was the president's, this is President Truman's Conference on Fire Prevention, right after World War II. It adopted the military, it was right after World War II, the military model for prevention of the 3 E's, education, enforcement, and engineering. We talked about sprinkler systems and 10-year lithium battery smoke. They're engineered solutions. Public education is another solution. And then what I do with the fire code enforcement. America Burning in 1973 actually had called for the creation of the U.S. Fire Administration and the National Fire Academy, made all these recommendations. And then you see the other documents, but they all say the same thing, that it's easier to prevent them, it's more effective to prevent them, it's cheaper to prevent them than it is to fight them. This is a quote from the then U.S. Fire Administrator, and it puts it in perspective. The fire deaths are equivalent to a World Trade Center type of disaster happening every year. Now, in America Burning, I pulled this quote out. It requires fire departments to consider the means of reducing fire loss beyond firefighting. To you health folks, this is a no-brainer. This is just common sense. But this just hasn't been pushed down to the local levels. And I think there's some legacy issues there. And like I said, the fire service, we write this, we read this, we give it lip service, notwithstanding the survey, but we don't really believe it ourselves. This is sort of an inside self-deprecating joke. The fire department, 200 years of beautiful tradition, unimpeded by progress. And it is sad, and it's true. I'll give you a little case study. There was this in the 1970s was probably the height of the fire department staffing. We've never had more people in the Baltimore City Fire Department than we've had in the early 70s, and they started to close firehouses. Well, those firehouses were laid down in the 1800s when fire engines were pulled by horses. So you had to have one on every other corner. And the fire service just howled when they started closing these companies. And in fact, if you had a line graph of staffing in the Baltimore City Fire Department and fire deaths, as the staffing has dropped, the fire deaths have dropped. Not that one has anything to do with the other. It's because of better fire code enforcement, better codes, more technology, more engineered solutions, and more prevention. But if I said that at a union meeting, they would stone me. Fire department culture is not prevention oriented. Prevention is viewed as a function of my office. In fact, I have a bureau called the Fire Prevention Bureau, and that's good that they dedicate a whole bureau in the fire department for fire prevention, but then it also kind of segregates out that piece of the puzzle in the minds of line firefighters. Oh, give it to Chief O'Brockie, his people come, and what some of these companies, and I'd love to be able to talk to some of the people in the surveys of what they consider public education. A lot of these companies go out to schools, let the kids jump on the fire engine, squirt some water for them, and tell them to stop, drop, and roll. And I don't consider that, and we don't consider that effective fire prevention. It's a nice start, it's a nice touch, but it's not really going to get the job done. No one comes into the fire department saying, God, I can't wait to get out there and put up smoke alarms. It's fun to fight fires. It's fun to ride on the engine. It's fun to kick people's doors in. Don't tell anybody I said that. But, it's just not the glorious job. We don't give out medals on Medals Day because a guy put up, 25 smoke alarms in one day. We just haven't figured out a way to incentivize these prevention activities beyond their own conscience. So we're trying to build in institutional steps. We're trying to really instill prevention at the interview process before we hire people, in the fire academy, and then more importantly, in the promotional process. I personally have lobbied for the next captain's and lieutenant's test to include questions regarding prevention and public education. Then they know it's important. For the first time ever, we actually had smoke alarms put in as a budget line item in our budget. We used to just get donations and we gave out whatever they gave us. That was a huge step to make our program viable. In Canada and in Europe, it's a completely different mindset. Their main mission is fire prevention and public education. And a lot of their mandates said they will be authorized to fight fires if necessary. And it literally says when necessary. 1/3 of the firefighters' time in the UK must be spent doing fire prevention, 1/3. Let's compare that to the city. They're required to do 2 hours a week, and that's in a 42-hour week. I personally think they should do 2 hours a day, but baby steps. You have to have buy-in. We have a very progressive chief who doesn't just give lip service to fire prevention. He actually puts dollars behind it. That's how you'll never hear a politician or a fire chief go, yeah, the smoke alarms are lousy. That fire prevention is lousy. No, they'll never say that. The way fire chiefs really talk and politicians really talk is with dollars and cents. When you put money behind stuff, then it becomes important. You can stand up here all day and say it's important. But and they have to know it, the leadership, before you get any kind of buy-in from below. But on to the topic that we're talking about, enough about my whining about fire department culture, is these really useful partnerships. We partner with Johns Hopkins as a partner. I think it started in 1992, I think our original partnership, and the University of Maryland to a lesser extent, and even the health department. And there's been a learning curve I've noticed in the health community the last couple of years that never really thought of fire as a health issue. The Baltimore City Department of Health, the state, and you guys at the School of Public Health are really starting to focus in on that. Like, I never remember any of my predecessors being invited to Hopkins to speak on fire prevention or to talk to students about it. The Healthy Homes program just recently, that's the health department's canvassing program, just recently started to do smoke alarm referrals recently in the last 5 years. And these guys were in the community all the time because we have trouble gaining access. We only get into about 30% of the places that we knock on. So these guys are in there. They check the stove, they check for CO, they check for bed bugs and lead abatement. Well, now they're starting to check for smoke alarms too because they realize this is a much bigger problem. CO gets all the press, but fire is what kills people. These are joint programs that we talked about. I know that Shannon brought up the Mobile Safety Center. State of the art. Nobody has anything like this in the country that I've seen. I took that to the National Conference of State Fire Marshals a couple years ago, And they made comments like, well, it's nice to see a vehicle that we could only dream about having. I mean, this really is cutting edge stuff. It takes the hospital-based safety center, puts it on wheels, and puts it out in the community. And the smoke alarm study, which I'm going to talk about now, we've been doing community canvassing since the 1970s in various forms. Since 2000, we've installed over 200,000 smoke alarms. They were the old conventional type of smoke alarm where you had to change your battery every 6 months. It has reduced fires over the last 20 years, fire deaths, and it hasn't been enough to drive the fire death rate below 3 times the national average. So we know that if we can maximize our opportunities in this program, that we can drive it down. Eileen mentioned that last year, calendar year, we had 19 fire deaths. That was a historic low for a calendar year. This year, this fiscal year, we had 16 fire deaths, which is a new low, and we're on track for the calendar year to have another record low year. And that's on the backs of the smoke alarm programs and our fire prevention, not on suppression. And that's what I told those firefighters the night of that fire. This wasn't a failure of firefighting. You guys did a great job. It was a failure of fire prevention. You know, you can't get here too much quicker than 2 or 3 minutes. You can't knock the fire too much quicker than 5 minutes. But when you figure in an environment like that, those residents had probably less than 2 minutes once they discovered the fire. You know, that doesn't look great for their chances. So Hopkins was gracious enough to study, and are studying right now, our program to try to increase our efficiency. They look at our standard fire alarm canvassing program with just sort of passive observers and data collectors, and then they have an intervention community which put into practice a lot of the CDC recommendations. We already put a lot of those in ourselves to begin with, the 10-year lithium battery smoke alarm, and different other, they also talk about putting community health workers out there ahead of time. One of the real benefits, sort of collateral benefits of this, is they did a focus group for us to find out what our firefighters thought about our program. And the results weren't surprising, but they were interesting. And that was one of those things that we learned from Hopkins. There have been, challenges. Our methods and their methods are quite different. You know, they are very methodical and very patient. I don't think that they buy a pretzel without, studying the specifications. And they're sort of, let's study it. Let's take our time. Let's kind of truck on. And fire departments just aren't that way. I mean, we can't stand aside of a fire and discuss how we're going to fight it while the place burns. I mean, we got to do it, We are a lot more action-oriented, but at the same time, a lot less introspective. We don't evaluate ourselves. We collect huge amounts of data and really never look at it. We make decisions based on anecdotal evidence, and we really need to start making more evidence-based decision-making, of where we spend our money, where we put our resources, where we spend our time. And Hopkins has really shown, at least me, that in a lot of instances, slower is better to make a decision once instead of, the fire department's constantly evolving. If this doesn't work, let's try this, let's try that. And Hopkins really sort of, you heard the old carpenter's notion, measure twice, cut once. They measure 15,000 times and cut once, But the demographics of the two groups when we first started the Mobile Safety Center couldn't have been more different. In another similar talk that we gave before, Andrea Galen, who's not here, talked about the marriage of cultures between the BCFD and Hopkins. And it really was like a marriage because my staff was entirely male and their staff was entirely female. My staff, with the exception of myself, was entirely African American. Their staff was largely Caucasian. Their staff was very young and highly educated, and my staff was middle-aged or older. Some of these guys were grandfathers and basically had a high school diploma. So there was a lot of differences to overcome just in the nature of the two entities. But, mutual respect will take you a long way to overcome those differences, and I think that's the key of any partnership. And you also, to have a good partner, you have to be a good partner. You can't steal all the credit for yourself. I don't think we've ever had any press conferences or any kind of press events where Hopkins didn't acknowledge our contribution and vice versa. So it really is, and sometimes you have to sort of backseat all your priorities to accommodate some other priorities of other entities in the partnership. We have different concerns that we have to work with. I have union contracts I have to deal with, working hours. Hopkins really doesn't have that. They, can put people out there whenever they want. I'm not allowed to order mandatory overtime. So sometimes there's staffing issues on the weekends and the evenings because my staff works business hours. We have political concerns in regards to, we might have something scheduled for the MSC, and I get a call from the mayor's office or the fire chief and say, no, I need that here. This is really important. And then we have to jockey the schedule around to accommodate both needs. It was funny because under the union contract thing, I had someone from Hopkins say, so-and-so really does a great job. And she kept saying that. And I knew she was getting at something, and she said, I wish he was in charge of public education. And I said, I wish he was too, except the civil service process, I can't just take my magic wand out and make him a lieutenant or a captain. There's a process there, even though he is very deserving of it. And then with the budget process, we went to outcome-based budgeting, so now we have to write up proposals and fight not just with other city agencies, I have to fight within my own divisions for that pot of money. Prevention sells good until you start talking about closing firehouses, and then it doesn't sound so good to fire chiefs and politicians who say, not in my neighborhood, but they can shut me down very easily, kind of behind the scenes. And with that budget process, we talk about legal mandates. When I was told that I had to cut 10 or 15% out of my budget, now the good news is it was restored, but they said, well, what can you cut? And I said, well, I'm legally mandated to enforce the fire code. I'm legally mandated to investigate every fire. I'm not legally mandated to do any public education. And that was the sobering truth that, hey, there is no legal mandate that the fire department will educate the public in stopping fire loss. I've always said about the fire problem in the Baltimore City and the United States is a good news, bad news situation. The good news is we have the solution. The bad news is nobody thinks it's a problem. And then Hopkins challenges, how can I forget, is the IRB that I hear so much about. I don't know what they do, but apparently they're a big pain. I don't know. And then grant funding. As much as our budget process is cumbersome, at least I know I'm going to get some money every year. I have a finite amount of staff, but I know they're going to be there. This grant funding comes and goes, so a lot of their deal is salesmanship. They have to go out and find grant money, find sponsors. I have one guy to convince, the chief of the fire department. They have to constantly find funding tracks, and I am not envious of that. So here are some of their challenges. We're meshing the two cultures between Hopkins and the BCFD, which we've done nicely. The more that Hopkins goes out with these line firefighters and observes them, that's been a challenge because they're not used to that kind of scrutiny from a civilian entity. And the Hopkins folks fall outside of our chain of command. And that's another cultural difference. We have a very strict, rigid chain of command. The lieutenant knows that he answers to the captain knows he answers to the battalion chief knows the answer to me. And I know I answer to the chief of the fire department. But in Hopkins, they're sort of a working group and nice group hug all the time and, love and feel, and, I ask people to do things, but in reality, I'm ordering them to do it, and they know that. So we mesh our two cultures, and now we're having a little bit of pushback from the field over our very aggressive smoke alarm program. And that leads into overcoming these antiquated attitudes within the BCFD towards prevention programs. And I could just take out the within the BCFD and I could put within the fire service in general. Ensuring accurate reporting is a big challenge. Hopkins requires really specific, accurate reporting. And not that we don't, but report writing has never been something that's been instilled. We underreport everything. And because we are the record keepers of the fire department, we are constantly harping on these fire companies, this is not a good report, you're underreporting things, and just shortchanges ourselves in the budget process. But in the police academy, they instill report writing day one all the way through, not so in the fire service. So accurate reporting has been a problem in the fire service, but it's especially a problem when Hopkins so relies on accurate reporting for their report writing and their grant funding. We have, challenges engaging a really growing non-English speaking population. We have two really large non-English speaking populations. One is Korean and one is Latino, and they are both wholly distrustful of people in uniforms. The BCFD bureaucracy related to vehicle maintenance has been really, really hard to overcome. And I've had to do a lot of arm twisting to get through that red tape because we don't maintain our own vehicles. That's fleet maintenance. So the chief of the fire department can jump up down all day long, and they really, I don't want to say they don't have to listen to him, but he doesn't fall within their chain of command. So he has to go over to fleet maintenance, their top guy, and it's really a lot of red tape. And it'd be so much easier if we could just send it to a private vendor and write a check, but it's just not that easy. So these are a lot of the challenges that Hopkins had to get used to, that we had to get used to. But with these challenges beget a lot of opportunities. We have already learned a lot from Hopkins. We vet a lot of our training documents and our training program through the Hopkins group, just as another set of eyes, and maybe you want to think about this. The focus group I felt was invaluable in the training process because we got to use those recommendations that those line firefighters gave us and throw them right back at them. We made this change because you said this. So they couldn't criticize a program that they had a part, whether they knew it or not, in creating. Hopkins can benefit from our fire department community ties. The fire service is well loved in the community, all communities. I had a buddy of mine that was a sergeant at the police academy, and he says that every day, the first day of police academy, he lines up all the new probationary employees, and he says, people are going to hate you for your job. If you want to be loved, go to the fire academy. Yeah, and it's true. They did a city survey, and 92% of the citizens said they loved the fire service. They had no complaints with the fire department. And that's rare for a government entity to get that kind of, those kind of big numbers. We have a really good opportunity to impart fire prevention strategies to these challenged communities. And when we get in their home and you give people something, you get a chance to engage them, get a favorable response, and do a real-time risk assessment in their home, standing in their living room, saying, that power strip is overloaded. You really need to watch that. You need to clear out that space at 36 inches around your water heater and everything. And people respond, We have an opportunity to install lithium batteries that will make these homes, quote-unquote, fire safe for 10 years. We look at the different fire deaths we have, and the homes with smoke alarms that didn't work in fire deaths made up the largest portion of fire deaths in dwellings. They had smoke alarms, it just didn't work. They took the battery out, or the battery was dead, and there's a variety of reasons. And we tried to engineer a solution to that problem with the 10-year lithium battery smoke alarm. And then it creates goodwill in the community for both our institutions, both Hopkins, which is already well respected, and the Baltimore City Fire Department. Thank you for your time.
Thank you to all our presenters. We'll now open it up to questions for anyone here in the live audience. For those of you watching online, you can simply click on the link right below the screen and email us your question. So we'll go ahead and open it up. Yeah.
I'd like to thank our presenters for really superb talks, and especially I thank Chief Obrocki for coming and being with us today. And I'd like to ask you, Chief Obrocki, about inspecting public buildings for fire code violations. Just a couple of days ago, I was in a secondhand clothing store in Timonium, which has upstairs, you go up a staircase, and there's a chain of about 5 rooms, all full of stuff, and there's no fire escape. Now, and I'm faulting myself that I haven't already called the fire department in Baltimore County about it, but is there any...
Yeah, I wouldn't point out that was Baltimore County.
Is there any sort of routine checking for fire code violations that would enable a fire department to find out about such a thing?
We're hamstrung in those inspections. We have basically two types of inspections. The one would be inspections that fall within our fee schedule. The fire code mandates that we can put certain occupancies, and occupancies are divided up in 9 separate types of occupancies for permits, operational permits. So we do annual inspections on those permitted properties. However, if you don't fall within that fee schedule, you get a one-time only inspection, and then we never come back in there again. The other type of permits are complaint investigations, like you would call the fire marshal in Baltimore County, and you would make that complaint. That would give enough probable cause to go there, and if they didn't want to allow an inspection, you could seek an administrative warrant and gain entry. But that's we don't, and I frankly don't have enough staff to inspect every single occupancy in the city. So I'm really hamstrung by that staffing issue and the fact that we only permit a portion of the buildings you see every day.
Yeah, Henry.
I really like this theme of the partnerships that you both touched on and the challenges in partnering. So you were talking, Chief Obrecki, about the partnership between the fire department and Hopkins directly, which worked. And I think that's really important for all of us to really look at. Would it be easier for a fire company maybe to partner through the health department? Could that link be there? You talked about the Healthy Homes program, but you would think that fire and the health commissioner could have a line of communication, but
we dovetail. We dovetail nicely with the Department of Health as well as Hopkins. We sit quarterly. We have a member that sits on the Child Fatality Review Board. We also, any kind of code enforcement, whenever we have a problem, sort of a problem child of an occupancy, instead of us going there and then building and then health, we have a really sort of synergistic relationship where we'll go as a task force and hit them all at once. There's good communications between, we've had an acting director of health ever since Dr. Sharfstein left to join the Obama administration. So there's been this gap. The person who took over, a very capable woman, wasn't in a position where she could really build any programs, or she is basically keeping the ship afloat until the next person was appointed. But no, we have had a lot of joint efforts with health recently, within the last 5 years.
And could that be a vehicle to connect with the academic institutions?
I would say that would probably be a good vehicle. I don't see why you wouldn't just go directly. And I don't know of any other fire department / academic collaboration anywhere near what we have with Hopkins. And like I said, we have a lesser extent with the University of Maryland, their Safe Kids Coalition, on an elementary school level program, but none of this sort of unilateral 50-50 partnership on a vehicle. Actually, that vehicle was several $100,000, and that collaboration bought that vehicle. We couldn't have gotten the money all by ourselves. They couldn't have gotten the money all by themselves. So it truly is a 50-50 partnership.
Yeah.
Are sprinklers 100% sure of never sprinkling when there's no fires?
Well, I don't know
if
if
you could
any.
just repeat the question.
Yeah, the question was: are sprinklers 100%? I guess they never fail. They only go off when there's a fire. Yeah, I would say that the technology now is better than it's ever been. They never fail on their own. Like it has a fusible link or a frangible bulb. They are, as long as they're installed properly and placed, like you wouldn't put a sort of a quick activating head by a deep fryer. As long as you have the right temperature setting for the head in the right location, and certified sprinkler fitters know this, they are 100% safe for any kind of water damage. On that same issue, if you hang your clothes from them, they're going to fail. And that has happened. People take their hanger and stick it in there and boom, there goes the sprinkler head. Or the ones that aren't recessed in the ceiling are subject to being sheared off if somebody's careless. But that kind of mechanical failure could happen with any system, including your regular plumbing. Now, a sprinkler head will discharge about 6 to 12 gallons a minute. 6 to 12 gallons a minute. Okay. A fire hose will do 250 to 500 gallons a minute. So that's quite a difference in the amount of water that's going to be dumped in your place if you have a little fire. And if you're not home, firefighters are going to kick in your front door, they're going to bash at your windows. And, it's a lot worse than a little bit of water damage. And I can tell you, in my career, I have seen maybe 2 sprinkler activations in over 20 years that weren't caused by a fire, and they were these mechanical things where a forklift comes by, and they've been all in commercial properties, none in a residential property.
Yeah, back here.
Chief McBricky was referring to the records keeping and how you guys are meticulous, but you need to be more so in and your partnership with the school public health has really helped to improve that. Can you, any of you, speak to what further details you seek when your firefighters go out into the community and look to install smoke detectors within the community, and how they document and how they're able to best describe their activities in the community?
Well done.
I'll take a shot at that one. May I be frank, Chief O'Brien? So Ray has been a wonderful partner in providing access to us at all levels. And so prior to getting into the field for our intervention, we actually were able, through his permission, to shadow a couple of teams that went out as part of their normal canvassing activity. And again, since prevention is not the reason why these individuals joined the fire service, they were there in terms of doing their community canvassing, but let's just say they weren't there fully.
Let's just say, lightly speaking, they were bitterly resentful for having Hopkins trail them.
One of the challenges that we found about data was that there was a tool designed by the fire department to track each home that the fire department visited and whether the home was safe in terms of having working smoke alarms in the home. So there were a variety of ways that form was filled out. Sometimes the team would complete a block and the record keeper would put a line down each thing and say, done, this block was done. It's very little information. Other times an individual may go a step beyond that and knock on the door. And literally one of our colleagues was home, who lives in the city, when her 12-year-old son answered the door to a firefighter who was part of a canvassing activity that day. The firefighter said, hey, we're here in your neighborhood checking to make sure everyone's homes are safe. And he said, we have smoke alarms. And the fire personnel put a check next to that address and went on their way. They didn't come in, they didn't test the alarm, they didn't ask the resident to activate the alarm, they didn't confirm that there was a working alarm on every level. And those are the kinds of changes that, working with Ray together with our team, he has been putting in place to have frontline personnel know that that home cannot be considered safe unless either an adult activates the alarm and the fire personnel standing outside can hear it, or the fire personnel are allowed in the home and goes to every level and checks for a working smoke alarm. So I think we've made a considerable amount of progress. There have been some challenges along the way, but I think the respect that our two organizations have for one another, the open lines of communications that we've been able to maintain, and really, quite frankly, through Ray's leadership, we've been able to, begin to see some positive changes in that direction.
On that note, one thing I can say more than anything about any partnership is you have to be prepared for your partner to tell you something you don't want to hear. Nobody wants to hear that your personnel was being rude. Nobody wants to hear that that they weren't doing their all or they were resentful. You don't want to hear these things, but you can't have this phony baloney sort of harmony when there's real problems. You have to be able to take criticism and be able to give it. There has to be this sort of honesty between the two groups to say, hey, listen, this went on and we didn't like it, and can you help us with this? Just like, I can go back to them and say, this really isn't working for me either. And you have to have that kind of flexibility and the ability to hear things that aren't so great to hear all the time.
Okay, I think we have time for one last question we have from online. We will have time for questions afterwards as well. But this is from California. Have there been examples seen in Maryland or elsewhere of fire partnering with public health for emergency preparedness activities, such as planning for a potential aerosolized anthrax attack? For local health departments, this planning is required.
Within the fire department, but kind of a separate entity, is the Office of Emergency Management. The emergency manager for the city works for the fire department, but he actually resides in the mayor's office. Weird, I don't know. But they partner on emergency and disaster planning, and then they run drills and partner not just with the fire service, but with the National Guard and law enforcement. So there's a huge collaboration. I can't speak intelligently that if it's legally mandated, but I know these are mandated by the different grants that fund OEM.
Okay.
I also just wanted to add, related to that question, that Dr. Jonathan Links, who's a member of faculty here at the School of Public Health, is also a member of the fire service, and he has been involved in those kinds of activities, although I don't know the details of it.
Yeah, and we also, our Center for Bioterrorism, a few years back, was running drills, sort of mock exercises with the health department involved, which was really interesting to see. So there was some preparedness planning going on with that initiative a few years back. I'm not sure where that stands now, but there are examples that we've seen here locally.
Okay. I think that's all we have time for today. I want to really give all our presenters a big hand for a terrific presentation. And thank you all for coming and tuning in, and we'll see you next month. Thank you.